So I am playing the role of Oshrat Ayalon today. She was a postdoc in my group for the last 2.5 years, but is now moving to her faculty position back in Israel. So instead, you get me. So there are lots of different kinds of mHealth technologies for many different purposes, many of which focus on kind of individual benefit, right? Like helping you track menstruation, helping with mental health, detecting cancer, so on and so forth. And of course, as many of us probably remember, during the pandemic, there was a lot of work to develop contact tracing apps, which are another form of health application, but focused on tracking people's contact with others to be able to notify in case of exposure. And these have primarily a collective benefit, right? It helps notify others that they've been exposed versus necessarily, it does tell you your own risk, but it has primarily a collective benefit. So in looking at these kinds of applications, they have privacy sensitivity, right? And there was a lot of work in our community to try to develop protocols to make sure that these contact tracing apps were developed in a way that was privacy preserving. But when it comes to user adoption, we know that people don't necessarily just adopt apps because they're private. And so in this research project, we wanted to take a look at the role of privacy relative to other adoption considerations, such as the accuracy of the app and the costs of using it in terms of mobile data consumption or battery life. And we also wanted to explore the role of offering extrinsic incentives, such as money. So this was something that people were sort of theoretically discussing, and there are actually a few field studies done where countries did this, where they wanted to pay people to install these apps. And we'll talk a little bit more about that later, but we wanted to take a look at how such extrinsic incentives might affect adoption considerations, as well as overall adoption. So, methodology-wise, we used what's called a conjoint analysis. So conjoint analysis is a technique that comes out of marketing research. So one of our collaborators on this paper is a quantitative marketing professor. And traditionally, it's used by, say, companies to ask questions like, if I'm going to put out a new car, what colors should I offer? How much might people be willing to pay for different color cars or cars with different engines, so on and so forth. And so what you will do is you'll present people with a pair of car options, and they'll make a choice about which car they want, and each car will be represented with a series of attributes. And as they make these choices in a repeated way, you're able to use statistical modeling to infer how important each of those attributes are to people. So we're going to use this technique, but instead of looking at cars, we look at apps, and I'll go into a little more detail in a minute. The other thing to note is that we did what's called a randomized conjoint analysis. The way to think about this is essentially that we ran 3 conjoint analysis experiments. That's not necessarily like typically part of conjoint analysis. Okay, so in these conjoint analyses, they're essentially survey experiments. We recruited over 1,500 participants from the United States during July 2020, so early in the pandemic. And we used quota sampling to ensure that participants' demographics matched those of the US Census within about a 5% confidence interval. Okay, so respondents were asked to repeatedly pick between pairs of app descriptions. And we told them, imagine there's a mobile phone app intended to help combat coronavirus in the US. Different apps have different benefits and risks and may collect different types of information about you. And the factors that we showed them in our analysis were based on factors from frameworks in prior work and those being explored in the public health community. And so what people saw was something like this, which showed them 2 applications with 7 different attributes. And so they would see this screen, and they could pick that they wanted either of these products or neither of them. And this doesn't represent all of the possible levels. I'll point you to the paper for that. But it gives you sort of a rough sense. When we did this, So the one piece that changed, if you remember I mentioned this was a randomized experiment, is that a third of participants saw these kinds of intrinsic incentives, right? The app is going to help researchers get data, or it's going to alert you if you've been exposed, different ways of kind of framing the benefits. And that is the section that we randomized. So all of these other fields were going to be consistent throughout the experiments. Okay, so in terms of the incentives, as I said, you have intrinsic incentives, and then there's two kinds of extrinsic, which basically means they have some kind of monetary value. The first was healthcare. So we could offer someone that the healthcare they need for a coronavirus infection will be free, since healthcare in the United States is not socialized, or an insurance premium will be reimbursed, so on and so forth. And in the strictly monetary condition, we can show people different kinds of gift cards they might receive for installation. Okay, so what did we find out? First of all, we wanted to understand, right, the ranking between these different kinds of attributes. And you'll notice, in particular, that privacy and costs, privacy is here in green, costs are here in purple, are split into multiple attributes because there are different aspects of costs. And so when you're looking at this diagram, kind of the high-level takeaway is that accuracy is the most important factor by a little bit. This is a statistically significant difference, but it's not a huge effect size. So people are kind of split between these three focuses when we offer them intrinsic incentives. Now, when we go and we offer them extrinsic incentives, things change. So these two charts are the one I just showed you. And when we add some healthcare incentives, what we see is that the incentive becomes much, much more important, while the costs tick down a little bit, but accuracy remains pretty much the same. So all of a sudden, we see that the incentive matters, much more so than previously, where it was around 15%. We see a very similar effect with monetary incentives. And a couple of kind of very small effects, but interesting facts to note, is that you see a small tick down in how much people care about mobile data use. And from an economic perspective, this makes sense because mobile data is something that you pay for, and extrinsic incentives are giving you money, and so people like to trade off what we call commensurable values like that. On the other hand, you actually see battery life tick up a very tiny amount because that's not something I can pay you to replace. Okay, so we know that if we give people incentives, they're willing to adopt slightly worse apps if you think of cost as worse, and that these incentives matter a lot. Does it change how many people are willing to install? So in order to answer that question, we look at this final option as a way of seeing people's receptiveness to the app. So in our experiment, there were some people who always clicked option 3. No matter what app you offered them, no matter how perfectly accurate or perfectly private or what you gave them, they just were not going to install it. And then we have people who were kind of on the fence. They would adopt some of the time. And we have people who most of the time would adopt. So when we offer these extrinsic or direct incentives, what we see is that people are no more receptive to adoption than if we offer them intrinsic incentives. So it might adjust a little bit their considerations, but you're not going to get more people installing the apps. So to kind of summarize what we have here, what we find is that when we're prioritizing requirements in applications, at least in the context of COVID, and it would be great to explore this in other contexts, we see that privacy matters, but people also put a lot of emphasis on other considerations. Accuracy being kind of a key example here, and one that was understudied in these contact tracing applications. And the thing is that when people provide their data or are willing to install an app, particularly in this kind of collective context, they care about how well it's going to work. And we've seen this in other work that we've done on medical data donation. People have a lot of questions about even privacy protections. Are they going to erode the utility of the data I'm giving up? So we always have an intent or a purpose in what we're doing, and accuracy plays a big role in that, as well as protecting ourselves with privacy. The effect of extrinsic incentives is questionable, right? So even before we get to kind of the experimental results, there's a big ethical question here of whether you should even be paying someone to install a privacy-sensitive application like this. And also our results suggest that even if you did make that kind of ethical trade-off, it's not necessarily going to get you more people installing. And when people have done field studies on these extrinsic incentives, what they see is that it increases adoption a little bit, but there's a big bounce back effect where people will uninstall the app shortly thereafter, and they actually end up with lower kind of total adoption. Instead, we can focus on the factors that matter to people and advertising around these kinds of factors, although of course we need to be able to measure them in order to make claims. So in summary, responsible data use is about privacy, but not just privacy. It's also about providing technologies that respect people's preferences, their tolerance for cost, and their interest in accuracy in this case. And we certainly encourage more work either using this kind of methodology or looking at trade-offs for installation of other privacy-sensitive applications. Thank you.